Good afternoon, and thank you for joining us once again here on Facebook Live. This is Dr. Larry Kidd here at Henry Mayo Newhall Hospital, and I'm joined again by Dr. Bud Lawrence, who is the medical director for our emergency department. So once again today we'll be answering questions that have been submitted to us and also provide some updates on what's happening here at the hospital in terms of COVID-19. The first question has to do with accepting donations from the public at our hospital related to supplies. So someone has asked whether or not we would take supplies if they're presented in opened boxes rather. And we will. Those donations can be directed to our foundation. The phone number is located on our website. And certainly we appreciate all the support that we receive from the community, and we have continued to receive donations. We have received some monetary contributions to our foundation, always welcome. And so please, if you have supplies that you think that we'd be able to use here at the hospital, we gladly be able to accept those and put them to use accordingly.
Yeah, we're very thankful for the partnership with our community. Thank you all who've already donated. The first question that I have is, when does California expect the apex of the virus to hit? Which is a really good question. It's something that's a little bit of an unknown. Basically, you'll hear people on the news talking about this all the time, that the surge is coming and they expect it to be here. I personally, don't quote me on this, obviously with everything we talk about, things change and there are many variables, but I personally think that we will likely start seeing a peak in about by perhaps the end of this week or middle of next week. That is pure speculation. There are people that are a lot smarter than me that are out there, these mathematicians, and they're able to do basically calculations on who has, how many people are infected, the ideas of how those people may be interacting with the population, how well we're doing with our stay-at-home policy, and all this predictive modeling goes into coming up with an idea of when they think a surge might happen. Again, that is still all guesswork. So really what we've done here is we've kind of battened down the hatches. We've prepared for our community as absolutely best as possible, and we are in a very good position right now. And I think that that we will likely see a surge. I don't think you're going to see what you see on the news from New York and Italy. Those places have a very different population density. We've kind of probably talked about this before. They use a lot of mass transit. For a lot of reasons, I think we're not going to see that big surge, but we are ready for anything. One thing I will bring up is that as Los Angeles County and the rest of the state of California rolls out more available testing that has recently become available, you're going to see the positive test number increase. I don't want anyone to freak out about that. That is absolutely expected. If you're testing more people, you're going to find more of the positives. So I think we need to keep everything in context and stay level-headed about this as we move forward into these really crucial next couple of weeks.
Right. Very good advice, Dr. Lawrence. We get frequent questions. We have one here today about whether or not a regular mask would be sufficient if someone were to cough or sneeze and you're in close proximity to them. Would the mask protect you? So once again, the way that you're most likely to contact the COVID-19 virus is through mucous membranes. So if someone were to cough, sneeze, etc., and you touch your face, mucous membranes being your eyes, your nose, mouth is where you could transmit to yourself. It's from your hands. So again, hand washing is the best defense. Distancing from individuals, of course, is very important. That helps to keep some physical distance between you and that person. Wearing a mask is for the purpose of protecting others. So the typical mask that you see individuals wearing out in the community, grocery store, pharmacy, etc., that is typically used, and the purpose of it is that the individual wearing it will not transmit. It is for the purpose of keeping the cough or the sneeze inside so it doesn't transmit out. So again, in order to best protect yourself, it is advisable currently to keep from transmitting to others in public places, to wear a cloth covering over your nose and mouth. And then again, from contracting from others, it's the distancing, hand washing, using hand sanitizer, avoiding touching your face, which can be difficult, I know. But if you can practice those three things, that is going to put you in a safer position when you're out and about.
Absolutely. Very good advice. So here's another really astute question that someone has is, will we have a test soon that will test if you have built up immunity to COVID-19, and will this test be available to the public? So that is, I don't want to get too granular or too fancy medical wise with people, but there is a test that's out there that measures something called IgM and IgG, which is basically your body's response to having had an infection, and in this case, COVID-19. So that test is available. It is commercially available, but it is not yet widely distributed, and it's very challenging to get a hold of those test kits. And I believe that there's a currently federal allocation of the kits to where they need to be. We are eagerly awaiting that test. I think that test will be extremely helpful on the healthcare front. So, for example, if both Dr. Kidd and I are in the emergency department and he has had this test and it shows that he has the IgG in his system, he is potentially at less risk for getting COVID-19 because he's theoretically already had it. And it brings up the other question of if you've had it, are you forever immune to this? And that is a very, very big unknown. Most coronaviruses tend to be seasonal, and from what we know from prior viruses, perhaps having it might confer a year or two of immunity, although certainly this virus may be different and may confer lifelong immunity once you've had it. These are a lot of unknown questions that once the dust settles here, as a healthcare provider, it'll be a very exciting time to learn so much about this disease process, but those are unfortunately things that we don't have answers to just yet.
Right. There's still a lot that's being learned about this virus, and the testing and the potential for developing immunity and how long it might last. Mm-hmm. So, yes, still a work in progress in terms of getting our arms around how best to combat this and address this in the future. We have a question related to handling food products. Going to the grocery store, how should one handle their produce and their canned goods, et cetera, when they get home? So there are still a number of tips that are being recommended in terms of primarily when you're in the grocery store is that thing again about distancing from others is the way you're likely to contract the virus. Not a lot is known about whether or not COVID virus can be transmitted through consuming of food, but of course with any food product you will want to wash as you normally would when you bring your fruits and vegetables home. Wash them as you usually would. There are products that are available on the market that are non-toxic. It is not recommended that you spray any type of chemicals onto your foods because it's very difficult to completely rinse and remove that, and you would not want to ingest a toxin by accident. There's some other tips that have been recommended in terms of when you get home with your food. If you're using your own bags, for example, you could potentially set up what would be considered a dirty side of a counter and a clean side. So starting with the products you're removing from your bags, you could wipe them down and then move them over to the clean side, etc. Wipe your bags down if they're recyclable that you take to the store. A disinfectant wipe is appropriate for that. And a number of nutrition experts basically say safe handling, washing your hands after you remove products from a container, a box, etc., and before you consuming that. So just keep up that good hand washing technique, and that's going to help a lot.
And yeah, really can't enforce that enough. The hand washing, it's I don't want to say it's a lifesaver, but it's basically could be a lifesaver at this time. So,
Yes.
a quick question here: how high of a risk is there for someone going to surgery? This is another great question. I think that many of you, if you were seeking elective surgeries, probably are aware at this point that the recommendation nationally is to cancel elective surgeries in the midst of this COVID-19 crisis. So, majority of people who were perhaps scheduling something elective or had something semi-elective, those surgeries have been put off for good reason. I think that it's not the best idea to bring people into surgery if you don't have to, for many reasons. You don't want to subject them to risk of getting sick, and you also don't want to have the increased burden if the patient has to stay in the hospital. We're trying to kind of clear out the hospital so that we can accept any surge that may occur. As far as having a non-elective surgery, there's not really good data out there right now to show one way or the other. Certain experiences have shown some things at some facilities and other things at other facilities. So I wouldn't really stand on anything. I think that if you need to have a surgery, you need to have a surgery. I think it's important to know that we are extremely diligent about essentially segregating out our COVID-19 suspected and positive patients from the rest of our hospital. Our hospital has exceptional processes in place for cleaning rooms and making sure that the patients that do not have COVID-19 are not exposed to that in any way. Our healthcare providers, everyone on our care team is very aware of proper use of personal protective equipment and decontamination procedures. And this goes for our emergency department, our surgical area, our inpatient area. I think it's very important. We've said this before. This is a community hospital. We're here for our community. As a physician, I don't want you staying at home with chest pain thinking maybe this will get better in the morning. Maybe it would, but what if it doesn't? And that's something that keeps me up at night. Just know that we are available for you should you need us, and we have all the measures in place to ensure that we're able to care for all patients, both COVID patients and non-COVID patients.
Right. Thank you, Dr. Lawrence. Can't emphasize enough, as he indicated, if you feel you have an urgent need, if you feel you have a medical emergency, do not hesitate to come in, because that could make the difference between coming in when you really need to come in versus waiting, and your condition could worsen and your outcome could be less than desirable. Just one other item along the lines of what's happening here at the hospital. A question came in about visitors and the fact that visitors are restricted, that sort of thing. And that is true. And the main reason for that is to protect both the individual that might be visiting the hospital and also the patients and the employees at the hospital. Because, again, individuals can be COVID positive, able to transmit the virus and have no symptoms whatsoever. It also helps us to maintain focus and concentrate on the care of the patients right now. And we do have provisions, special considerations are made, and on a case-by-case basis, we do evaluate whether or not an individual might be able to come in and visit. That is our time for today. We're winding down. We thank the viewers for tuning in today, and we will be returning again on Friday at our usual time. And we appreciate your tuning in, and do be safe out there.
And again, please put your questions in the comment section so we have questions to answer next time. I can't express to you all enough how much we at the hospital appreciate the support from the community, both in donations and food. You are our lifeline, and we are so thankful for you. Thank you so much for tuning in. Please be safe, be well, stay at home when you can, and have a good evening.
Okay, take care.